Wokhada Hospital and Dr. Farid's hospital. You can find me on FB link or on LinkedIn if you want to consult me. I'm available at both the places and for video consultation. I thank Baby Chakra for giving me this opportunity to talk on this important topic, which is role of folic acid during pregnancy. So I would say not during pregnancy, even before and after pregnancy, role of folic acid is very important, and that is what I'm going to tell you all about it. So first of all, why it is called the superhero of pregnancy? Every day in this era of Google, every patient who is coming to me knows about folic acid, and she knows that okay, doctor is going to prescribe me folic acid. So what is this folic acid? क्या है फोलिक एसिड जो इतना इम्पोर्टेंट है ड्यूरिंग प्रेगनेंसी भी है, पेशेंट्स जो कि कंसीव करना चाह रहे हैं उनमें भी दिया जाता है, एडवाइजेबल रहता है कि प्रेगनेंसी से 3 मंथ्स पहले हम शुरू कर दें फोलिक एसिड एंड प्रिफरेबली थ्रू आउट द प्रेगनेंसी, मगर एटलीस्ट फॉर फर्स्ट ट्राइमेस्टर मीन्स फॉर द फर्स्ट 3 मंथ्स ऑफ प्रेगनेंसी फोलिक एसिड ज़रूरी है देना. It's better if we give folic acid during lactation also, when you are feeding the baby. So why it is so important? Let's see what it is. So everybody knows about vitamin B complex. What is that B complex? B complex is called B complex because it comprises of multiple vitamins which have different roles to play in our body. So from B1 to B12, there are different vitamin B complexes. Yeah. So what is this folic acid? That's what I was telling you. Folic acid is one of the B complexes. B9 is called folate. Folate is the active form of folic acid. फोलेट हमारी बॉडी नहीं बनाती है, हमारी बॉडी में सिंथेसाइज नहीं होता है, इसलिए हमें उसको सप्लीमेंट करना पड़ता है. अदरवाइज आयरन, कैल्शियम एंड ऑल दोज थिंग्स विच वी टेल यू कि आप डाइट अच्छा लो, डाइट अच्छा लेने से आपको आयरन, कैल्शियम, बहुत से विटामिन मिल जाते हैं, बट दैट इज़ नॉट ट्रू अबाउट फोलेट. फोलेट हमारी बॉडी में नहीं मिलता है, इसलिए इसको सप्लीमेंट करना ज़रूरी रहता है. सो B9, बी कॉम्प्लेक्स में से जो B9 है दैट इज़ कॉल्ड फोलेट. अभी तक जो उसका एक्टिव फॉर्म है, फोलिक एसिड का एक्टिव फॉर्म इज़ फोलेट, जो कि काम करता है हमारी बॉडी में जा करके. अभी तक जो हमें प्रिपरेशंस मिलती थी वो फोलिक एसिड की रहती थी. जब हम फोलिक एसिड को लेते थे हमारी बॉडी में जाके वो फोलेट में सिंथेसाइज हो जाता था, जो कि अपना काम करता था. अभी जो लेटेस्ट प्रिपरेशंस है वो हमें एक्टिव फॉर्म में भी मिल जाती हैं, जो कि आसान हो गया है, हम एक्टिव फॉर्म में ही फोलिक एसिड को कंज्यूम कर लेते हैं. सो व्हाट आर द बेनिफिट्स? इसके फ़ायदे क्या हैं, हमें क्यों देना है, क्यों इतना इम्पोर्टेंट है ये? इसका सबसे बड़ा फ़ायदा ये है कि जो बेबी आपके वूम पे डेवलप हो रहा है उसका डेवलपमेंट, सारे बॉडी के ऑर्गन्स जो डेवलप होने शुरू होते हैं वो फर्स्ट मंथ से शुरू हो जाते हैं. जब सारे ऑर्गन शुरू हो जाते हैं डेवलप होने, तो हमारा ब्रेन और स्पाइनल कॉर्ड जो कि सबसे इम्पॉर्टेंट पार्ट है हमारे बॉडी का, वो भी फर्स्ट मंथ से ही डेवलप होने लगता है. तो जब फर्स्ट मंथ से डेवलप होता है ब्रेन एंड स्पाइनल कॉर्ड, फोलिक एसिड डेफिशिएंसी में जब हम फोलिक एसिड नहीं देते थे तब ऐसा देखा गया है कि उन बच्चों में न्यूरल ट्यूब डिफेक्ट्स बहुत ज़्यादा मिलते थे. न्यूरल ट्यूब डिफेक्ट मतलब neural tube we call, which develops into spinal cord. Spinal cord develops from neural tube. So in babies where mothers were folic acid deficient, it was seen that neural tube properly close नहीं होता था. प्रॉपरली क्लोज नहीं होता था तो बीच में डिफेक्ट रह जाता था. उस डिफेक्ट की वजह से बेबी में जो कमियां आती थी, बेबी डिसेबल्ड होता था फॉर द लाइफ, फॉर हिज होल लाइफ पैरालाइज्ड रहता था. ये काफ़ी स्केरी कंडीशन थी. तो ये देखा गया कि जब हमने फोलिक एसिड सप्लीमेंट करना शुरू किया तो ये रिस्क ऑफ एंटीडी न्यूरल ट्यूब डिफेक्ट्स बहुत सब्सटेंशियल नंबर्स में कम हो गया. So that is a most important role of folic acid in our body when we give it to pregnant patients. Then second is anencephaly. Anencephaly is when upper part of brain and part of skull is not formed in the baby. When baby is in your womb and upper part of skull and upper part of brain is not formed, in that condition, baby cannot live once it comes out of womb. So initially, when sonography was not so popular, sometimes after delivery we used to discover that okay, this baby is anencephalic. Nowadays, with advancement, we have very good sonography machines which can uh, discover all these problems in babies very soon. So that is another very important point. Why should give folic acid? It reduces the risk of anencephaly in the baby. Then sometimes you might have seen babies with cleft lip and cleft palate, which is called hair lip also, like a rabbit. In those cases also, this condition might vary from mild to severe. If it is mild, you can just see a cut on the lip. If it is severe, it might extend to the palate. Palate is upper part of our mouth. When baby sips or takes feed, that feed might come out from the nose. So that defect is there. So baby might get choked or baby is not able to take feed. So that is again a very risky condition to be in. Then it reduces the chances of premature birth. It is seen that if you give enough folic acid during pregnancy, it reduces the chances of premature birth. Then baby's weight is also dependent. It increases the baby's weight also. So there are less chances of giving birth to low birth weight babies, which we call as IUGR, intrauterine growth retardation. It reduces the chances of IUGR. There are many other factors also which give rise to IUGR, but folic acid is one of the factors. Then there are reduced chances of certain heart defects when we give folic acid, and it it's important for the synthesis of RNA and DNA. RNA and DNA, you might have heard about DNA. It carries forward genes from mother to children. So it is very important for RNA and DNA synthesis. And also it is important for amino acid metabolism. When amino acids are building blocks for proteins. So if amino acids are not metabolized properly, then there is problem in forming the body bulk, you can say. Then these are the benefits when we give folic acid. तो बच्चे में क्या क्या benefits हो सकते हैं, and these are very important things because there are serious problems when we don't give folic acid. So it's very important for the babies, but at the same time folic acid mothers के लिए भी बहुत important है. Mothers में भी बहुत ज़्यादा फायदा होता है when we give folic acid. So what are those? In mothers, it is seen that it reduces the risk of preeclampsia. Now, what is preeclampsia? Preeclampsia is a condition which happens during second trimester. Second trimester means around the 5th month of pregnancy. उसमें लेडी का ब्लड प्रेशर राइज होने लगता है, बॉडी पे स्वेलिंग आ जाती है, ब्लड के कुछ कंपोनेंट्स काफ़ी कम हो जाते हैं, और ये सारी चीज़ों को मिला करके हम प्रीएक्लेम्शिया बोलते हैं. दैट इज अगेन अ डेंजरस सिचुएशन for a pregnant lady. So it reduces the risk of preeclampsia in a lady. Then it reduces the chances of stroke. Then it helps in the prevention of few types of cancer, mainly colon cancer in the female. So you see, it's not important only during or prenatal periods. Even otherwise, if you take folic acid, it's helpful for your body. Then it plays an important role in the production of RBCs. Some types of anemia are because of folic acid deficiency. Folic acid plus B12 deficiency. It's not always iron deficiency anemia. So when a patient is anemic, it might be folic acid and B12 deficiency also. So that way also it is helpful. So how I'm very sorry, you have to bear with my voice because I have a very bad sore throat. Sorry about that. So these are the benefits of folic acid, why we are giving it and why there is so much of importance of folic acid. So how you can get folic acid apart from the tablets which we give you, और क्या आप खाने में ले सकते हैं जिससे आपको फोलिक एसिड मिलता है? सबसे इंपॉर्टेंट चीज है फोलिक. फ्रॉम वेयर इट कम्स फ्रॉम? इट कम्स फ्रॉम foliage. Foliage means green leafy things. So whatever green leafy vegetables are available in the market, not only spinach or kale leaves, but whatever green leafy vegetables you can get hold of, those are all rich in folic acid. Then there are few legumes, lentils, beans. All these things are rich in folic acid. So apart from taking tablets, you can also include all these things in your diet, which are rich in folic acid. People who take eggs, they can take eggs. Then non-vegetarian people, they can get liver. Liver is very rich in folic acid. So all these then there are seeds like melon seeds, sunflower seeds. All those seeds are quite in vogue these days. Those are called seeds of life, seeds for life. So those seeds, you can just make a salad and sprinkle few seeds over that. Those are also quite rich in folic acids. These are the sources of folic acid. All the citrus fruits which you take, then these are the sources which can include all these things in your diet. But apart from the medicine, apart from the tablet which you are taking, what are the dosage which we give during in a normal female which doesn't have any deficiency already, and when she gets pregnant, normal dosage is 400 microgram. So 400 microgram to 500 microgram we can give you when you get pregnant or when you are trying for pregnancy. If like some doctors, they prefer to give it for the full 3 trimesters and even during lactation. So in second and third trimester, second trimester starts from fourth month, third trimester starts from seventh month. सो उसमें 500 माइक्रोग्राम की रिक्वायरमेंट रहती है. व्हेन यू आर फीडिंग योर बेबी ड्यूरिंग लैक्टेशन 500 माइक्रोग्राम दिया जाता है. वन मोर इम्पॉर्टेंट थिंग, इफ देर इज अ हिस्ट्री, अगर आपको पहले प्रेगनेंसी में बच्चे को ऐसा प्रॉब्लम हो चुका है जिसमें न्यूरल ट्यूब डिफेक्ट हुआ है, स्पाइनल कॉर्ड में बच्चे के डिफेक्ट था और इस प्रॉब्लम की वजह से बच्चे को अबॉर्ट करना पड़ा था, अगर ऐसा प्रॉब्लम आपके साथ पहले हो चुका है तो फिर डोसेज ऑफ फोलिक एसिड हमेशा ज़्यादा दी जाती है. इन दोज केसेस इट्स ऑलमोस्ट 4000 माइक्रोग्राम पर डे. So these are the doses, but you don't have to bother about the doses. You know, you just have to go to your doctor, and your doctor is the best person who will decide about the doses or folic acid for you. Because requirements सबकी अलग अलग हो सकती है, तो तुम्हारे आपके रिक्वायरमेंट के हिसाब से डॉक्टर विल डिसाइड कि आपको कितना फोलिक एसिड देना है. एंड देर इज नो हार्म इफ यू टेक फोलिक एसिड. सो कुछ कई बार पेशेंट्स पूछते हैं कि आप क्यों दे रहे हैं, लाइक व्हेन दे आर ट्राइंग फॉर प्रेगनेंसी एंड वी स्टार्ट विथ फोलिक एसिड्स to them along with other medications, they always inquire about it. It's a type of B complex, it's a type of multivitamin. So like you take other antioxidants and multivitamins, आप इसको भी ले सकते हैं and it has all the benefits which I told you. So इसका benefit ही है, कोई नुकसान नहीं है. So folic acid, that is why now I have told you all the risky conditions which a child might suffer when a lady is deficient in folic acid. So that is why folic acid is very important. So I'll invite if you have any questions. I think nowadays everybody is so aware of folic acid that they just Google all the things. I have a question. Is there a change in the nutrition labels regarding folic acid? How do I make sure I'm getting enough folic acid to help prevent neural tube defect, which are serious battlefield of the brain and spine? As I told you, tube defect, spina bifida, and anencephaly are two major and very serious neural tube defects, which might happen in cases of folic acid deficiency. So, doses, as I told you, don't decide it yourself. Let your doctor decide it for you. But usually, if you see a label which contains 5 microgram, 400 microgram to 500 microgram, so that much is enough folic acid for you. अगर पहले प्रॉब्लम हुआ है जैसा मैंने बताया, इन केसेस में यू माइट require 4000 microgram. So you have to check on the label how much folic acid your tablet contains. That will tell you whether you are taking enough folic acid or not. What is blood folate concentration? I didn't get your question actually. Blood folate concentration. Yeah, folic. Is folic acid safe? Yes, acid is absolutely safe for you, as I told you. You can continue taking it because your body doesn't synthesize it. So you have to supplement it always. So in normal time, what happens that your diet is normal. If you are taking a well balanced diet से पूरा हो जाता है आपका न्यूट्रिशन. But when you are trying for pregnancy, or when you are pregnant, or when you are lactating, like when you are feeding the baby, these are the times when you require something extra. Whatever nutrition you are taking in your diet, you require something extra along with that. So folic acid, we need to give you extra. Your diet, whatever you are taking, may not suffice for these conditions. So that is why we have to add on to folic acid during these times particularly. But even otherwise, when you're not pregnant, or when you're not feeding, even otherwise, if you take folic acid, there is no harm at all. What is the tolerable upper intake level for folic acid? So tolerable upper limit, like we have given, like we give up to 5 milligrams of folic acid to pregnant ladies. So up I don't think it is required by the body. More than 5 milligrams is not required by the body. So we should not take more than 5 milligram in any case. Does taking higher dosage of folic acid cause or worsen cognitive impairment among older adults with a vitamin B12 deficiency? Higher doses, no, I don't think so, because this is good for cognitive function. I forgot to tell you that folic acid is very important to reduce Alzheimer's in elderly patients. So for nerve health, B12 and folic acid both are required, and in fact it improves your cognitive function when it is taken with B12. And taking higher doses doesn't harm, because it will be excreted by your body. Whatever extra you are taking, that will be excreted by your body. So body takes whatever is required for the function. Why are women advised to supplement with folic acid before becoming pregnant and during the first trimester of pregnancy? uh, I think I covered that in my talk, that women are advised to take folic acid because of multiple reasons. It helps to get them pregnant. It helps in the synthesis and metabolism of amino acids. And when a patient gets pregnant, then it reduces the chances of neural tube defects, spina bifida, and encephaly. And also at the same time, it reduces the chances of anemia in mothers, and uh, preeclampsia and stroke. So that's why we always prefer to give folic acid. In which foods do folate occur naturally? Naturally, folates we find in green leafy vegetables, legumes, beans, and citrus fruits, then egg and liver. People who are non-vegetarian, they can have liver and eggs. Otherwise, in vegetarian sources, green leafy vegetables are the most rich source of folic acids. What are the effects on health of folate deficiency? Folate deficiency will lead to your cognitive systems defects. Like when you're not pregnant and you are deficient in folic acid, you might suffer with anemia, you might suffer with nerve pains, and your nerve health will get impaired, and at the same time your cognitive functions will also get impaired during pregnancy and after pregnancy, and when you are trying for pregnancy. It is required for the various reasons as I told you, but even otherwise it is very important for your cognitive functions and the nerve health, and it helps in the formation of RBCs, so it prevents anemia. So even otherwise, when a patient is anemic, we should always check on B12 deficiency, folic acid deficiency, and we should always supplement. So takeaway message from my side will be that keep your diet rich in green leafy vegetables, salads, lots of citrus fruits, and don't ever miss your folic acid tablet, even when you are trying for pregnancy or when you get pregnant, and take your doctor's advice, whatever dosage, whatever timing she tells you to take. Please don't skip your folic acid tablet ever. That's all. And I thank Baby Chakra for giving me the opportunity to talk about the folic acid, which is a superhero of pregnancy. Thank you.